Good evening, everyone. The topic for my today's presentation is counseling in the context of HIV or AIDS. As we all the differences between AIDS and HIV. AIDS, acute immune deficiency syndrome, is characterized by a severely weakened immune system, making the body vulnerable to opportunistic infections and certain cancers. However, not everyone with HIV develops AIDS, especially with early diagnosis and proper treatment. Then HIV, human immunodeficiency virus, is primarily transmitted through contact with certain body fluids like blood, semen, vaginal fluids, and breast milk. Common routes of transmission include unprotected sexual contact sharing needles and from other mother to child during childbirth or breastfeeding. HIV or AIDS is a virus that weakens the immune system by attacking CD4 cells, which is essential for immune defense. If left untreated, HIV can progress to AIDS, the final stage of HIV infection. At this point, the immune system is severely compromised, making the body highly susceptible to infections and cancers. The causes for HIV transmission are the following. The virus can be spread from person to person through certain body fluids such as semen and preseminal fluid, blood, rectal fluid, vaginal fluids, breast milk, etc. HIV can be spread if these fluids come in contact with the mucous membrane, damaged tissue, and bloodstream by injection. The other causes of HIV transmission are through vaginal or anal sex without using a condom with someone who has HIV who is not taking medicines to prevent or to treat HIV, through needle sharing or other equipment used to inject drugs with someone who has HIV. Less often, HIV is spread from mother to child. A pregnant woman can spread the virus to fetus through their shared blood circulation, or a nursing mother can pass it to her baby through her breast milk. Testing and treatment of HIV positive mothers can help lower the number of babies getting HIV. Through needle sticks or other sharp objects that are contaminated with HIV can also cause HIV or AIDS condition in an individual. The major symptoms of HIV are the following: fever and muscle pains, headache, sore throat, night sweats, mouth sores including yeast infection, then swollen lymph glands and diarrhea. Counseling in the context of HIV or AIDS. HIV counseling helps people to understand their HIV status, cope with the diagnosis, and reduce the risk of spreading the virus. It also helps people to access care and support. Post-test counseling should help people develop coping mechanisms for dealing with their HIV status and to realize that life is not over just because the result of a laboratory test. The counseling in the context of HIV is a vital support service aimed at helping individuals cope with the emotional, psychological, and social challenges associated with HIV infection. It provides a safe space for people to express their concerns, fears, and uncertainties about living with HIV and helps them make informed decisions about testing, treatment, and prevention. HIV counseling also focuses on helping individuals to manage stigma, improve adherence to antiretroviral therapy, and address issues related to relationships, sexuality, and disclosure of status. It may be provided through individual sessions or group counseling and is an essential part of comprehensive care for people living with HIV. VCT. VCT model emphasizes the pre-test counseling, a risk assessment, and the voluntary seeking of the test. Most widely implemented model of HIV. Counseling and testing is generally referred to as voluntary counseling and testing or VCT, where young people specifically seek the HIV test. In this model, young people receive counseling about their risk for HIV, obtain an HIV test, learn their HIV status, receiving counseling on how to cope with the test results and implications, and develop a plan with the provider to minimize their risk of acquiring HIV or transmitting the virus to others. Then, counseling and other essential methods are including uh, the test should be administered after the client has given informed consent to be tested. Confidentiality must be there. Test results must be available to clients. Counseling is needed to help youth understand what the test means, how to prevent transmission, how to change risky behaviors, and what type of services are available after getting the results. The counseling and testing services should be linked to youth friendly services for care and treatment, contraceptive needles, and diagnosis and treatment for other sexually transmitted diseases. Services: HIV testing and counseling, that is free testing and counseling at ICTS, then antiretroviral therapy, that is treatment of HIV through ART centers, then HIV prevention, that is information on HIV transmission and behavioral change. The next one is HIV TB cross referrals, that is referral to TB centers for people with HIV who are testing positive for TB. Counseling: one-on-one couple or family counseling on a range of topics. Then home-based care is there, care for people living with HIV in their homes. Peer support should be there, support from peer navigators and peer support groups. These are some of the services that is provided to HIV positive patients. The counseling techniques that includes active listening, that is fully attending to a client's concern and emotions without interruption. Open-ended questions, that is encouraging detailed responses and exploration of feelings. Then reflection, summarizing and mirroring the client's emotions to validate their experiences. Then empathy is there, that demonstrating understanding and compassion towards the client situation. Next one is normalization, assuring the client that their feelings are common and understandable. Motivational interviewing, that is helping clients to identify their own motivations for positive behavioral change. Key aspects of HIV counseling are post-test counseling, addressing stigma, discourse support, adherence counseling, partner notification, then mental support. These are the key aspects of HIV counseling. This is the picture of mother and the child who is getting awareness from the practitioners about HIV. Thank you.